Testosterone for women is pretty controversial. Physician groups often recommend that it's only used for hypoactive sexual desire disorder, or HSDD, in women. But the benefits of testosterone actually go far beyond low libido. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources, mostly about hormone optimization. If you're a patient and you're looking for some help, somebody who really knows what to do with your hormones, especially testosterone, stay to the end of this video and I'll tell you how I might be able to help you find what I call a hormone optimization specialist. Well, there's so much to say about testosterone replacement for women that I'm kind of going to need to break it into several videos. In this video, we're going to go over 3 important aspects of using testosterone replacement therapy in women. First, we'll talk about Hypoactive Sexual Desire Disorder, or HSDD, which is the only sort of officially recognized reason for women to actually get testosterone in the first place. We'll talk about the role of testosterone in the larger context of sexual desire, libido, and relationship. Finally, we'll quickly list several benefits of testosterone for women that go far beyond sexual desire and libido. Hypoactive Sexual Desire Disorder is the name of a diagnosis in the official diagnosis book that's used by physicians, psychologists, and other health professionals. The essential feature of female HSDD is a deficiency or absence of 2 things: sexual fantasies and a desire for sexual activity, but that has to cause some marked distress or interpersonal difficulty. The HSDD diagnosis means that a woman has low desire for sex, but also that it's a problem for her partner, for both of them. If a woman has low desire, but she doesn't really care, then she doesn't really qualify as having HSDD. There are a couple of FDA-approved medications for HSDD. One's called Addy. From what I can tell, it's not all that effective. Physician groups like the Endocrine Society and many others say that women with HSDD should be able to get testosterone, which can make a significant difference in their level of sexual desire. When we talk about testosterone, we often think 2 basic thoughts. First, it seems like testosterone is probably a male hormone, at least that's the way it's been portrayed. And second, testosterone is mainly about sexual desire. And while it's true that testosterone is called the hormone of desire, and it does have a big part in sexual desire, it's a big part of why both men and women have a physical desire for each other. What's not true is that testosterone is just a male hormone. Of course, men have way higher levels of testosterone than women do, but testosterone is also a crucial hormone for women, especially when it comes to sexual desire or libido. Testosterone is highest in younger people. Let's estimate between 18 and 30 years old, give or take. As we age, both men and women start losing our testosterone. It's often a gradual process over as many as 10 years, maybe a little longer for men than it is for women. Women begin to lose their testosterone as they get closer to menopause. Once they stop having periods and are officially in menopause, their ovaries have shut down, and the ovaries are the main place that testosterone comes from in women. I've talked about this in another video that I'll link to at the end of this one. Testosterone isn't the only thing that has an impact on sexual desire. There are lots of other things like relational issues. How's your marriage doing? Privacy issues. Do you have kids in the house or in-laws in the house or visitors or just a general lack of privacy? Do you have medical problems, drug side effects, depression, stress? Raising your cortisol levels from stress puts you in a fight or flight place, not a place that's relaxed and ready for sex. Body image. How do you feel about yourself, about your partner? Have either of you let yourselves go? There are many other factors that have an impact on sexual desire. Keeping all those in mind, and I guess all things being equal, increasing testosterone will increase sexual desire. Women between, say, 35 and 45 frequently struggle with low sexual desire. Testosterone might be a viable option to help those women get that spark back with their husbands. Women over 45 who are going through either perimenopause or menopause are even more likely to experience low libido concerns. Testosterone can definitely help them as well. They'll be the most likely to have low levels of testosterone. The evidence supporting the use of testosterone for low libido and sexual desire is very strong. Testosterone has a lot of other benefits in addition to helping women increase their sexual desire. Testosterone increases bone density. It can help prevent osteopenia and osteoporosis, which is basically hollowed out and weakened bones. Testosterone increases muscle strength. Testosterone decreases visceral fat. That shows up inside your abdomen, around your organs. It's always a bad thing and leads to some problems. Testosterone increases energy. It decreases fatigue, increases a sense of well-being. Testosterone decreases insulin resistance, and it helps prevent type 2 diabetes, which is a huge risk for women over 50. If you're a woman who has struggled with low sexual desire and it's a concern to you and your partner, you may want to see a hormone optimization specialist. That's a healthcare provider who really knows what to do with your testosterone, as well as all your other hormones. A hormone specialist can help you get all your hormones optimized. Click the link that says Find a Specialist to learn more. If you are a hormone provider and you're available to help patients optimize their hormones, join my hormone provider database and I'll see if I can match you up with some of my new patients. If this video has been helpful at all, click the like and subscribe buttons to get notified whenever I post a new one. Thanks so much for watching, and I'll look forward to talking to you again soon.